Thank you, Mr. Chairman, and thank you again for Dr. 𝗏𝗏 𝗏𝗏 and Dr. Ahmed Nasser for the invitation. Just a very quick question. How many of the panel and how many of the audience use drug-coated technology, whether balloon or stent, for intermittent claudication? Nil. Okay, let's start. So, the 𝗏𝗏𝗏𝗏 devices have been around for more than a decade, and it has been proved very successful in patency over the plain balloon or bare metal stent. However, Katsanos in 2018 dropped his bombshell about the increased mortality with drug-coated technology, especially at 5 years, and it has been shown that it is related to the dose. And this was the study that they based the results on. However, they used not the patient level data, they used just the summary level data. And you can see in that chart that the use of drug-coated technology in the US dropped after 2018, secondly to that meta-analysis. However, since that meta-analysis, there have been a turmoil in the vascular and interventional fields about the use of these technology. And that created digging deep into the patient level data rather than just the summary level data. And they based their main results on the PTX trial. However, looking into the PTX trial, they based the summary and conclusion on intention to treat rather than what actually happened. And looking at the PTX data, actually more than 70% of the patients received paclitaxel rather than plain balloon. And again, looking at the patient level data rather than the summary level data, there was no difference in the mortality between drug-coated technology and the bare metal stent. Looking at other devices, looking at the 𝗟𝗏𝗏𝗏𝗏 mortality data, they did not show any difference in the all-cause mortality between the drug-coated technology and the non-drug-coated technology. Looking at the SafePad, more than 168 patients, and more than 40% of them received drug-coated technology. Again, the chart and the graph doesn't show any difference, and actually the mortality was favored in the drug-coated technology. Looking at Voyager PAD as part of the COMPASS trial, with more than 30% of more than 4,000 patients received the drug-coated technology. And again, there was no difference in the mortality between the drug-coated technology and the non-drug-coated technology. Again, what about the patient level data rather than the summary level data in multiple RCTs? Again, all of them didn't show any difference between the drug-coated mortality, the drug-coated devices and the non-drug-coated devices. All the RCTs, when you look at the patient level data, there is no actual significant difference between both technologies. What about the Medicare Advantage? Again, more than 1,500 patients that have been followed up for more than 3 years was actual looking into mortality rather than just morbidity. And again, it didn't show any difference in the mortality between the two technologies. What about the preferred vascular registries, which represent actually the real world data rather than just RCTs? Looking at the National Cardiovascular Data Registry, more than 1,500 patients, more than half received drug-coated technology. And again, there was no difference between in the mortality. And again, looking at the vascular QALY, more than 5,000 patients, half of them received the drug-coated technology. Again, there was no difference in the mortality. What about the Veterans Health Administration data? Again, more than 10,000 patients, 20% of them received the drug-coated technology. And the unique about this, that they looked at the different causes of mortality, and they compared both the drug-coated technology and the non-drug-coated technology in all-cause mortality. And again, there was no significant difference between the drug-coated and the non-drug-coated technology. There has been talk about increased amputation risk with the drug-coated technology, especially in below the knee. And again, Katsanos led in that meta-analysis. They looked into more than 21 RCTs with 52% claudicants. And again, they found that amputation is slightly higher in the drug-coating technology, more than the plain technology. However, they excluded 19 RCTs, and they mixed apple with oranges. They can't compare intermittent claudication with CLTI. So again, this needs more and further investigation rather than take a stand. And again, you should separate the CLTI from intermittent claudication. Again, in the insurance data, more than 1,500, or just below 1,500 patients with follow-up for more than 5 years. Actually, in this data, looking at the mortality, looking at the amputation and all-cause mortality, actually the mortality and the amputation were favored in the drug-coated technology over the plain technology. Again, Cummins in 21 looked at more than 900 patients. It was almost 2/3 received drug-coated technology, and actually they found that the mortality and the amputation are better with the drug-coated technology than the plain technology. Looking at this very busy slide, on that left-hand side here, this is the meta-analysis that have been presented in 2018, and you can see that there is a trend towards just increased mortality. However, when there was an independent randomized data and patient-level data, this trend has not been found. A very important question here: where does the organizations like the FDA and MHRA stand on this? And this is a timeline of the FDA since 2018. They have been several meetings, several panels, and eventually they just are still waiting for the industry updated analysis based on the patient level data. However, the recommendation of the FDA stand at you should use the drug-coated technology when there is increased risk of restenosis. However, they haven't identified that. And the MHRA, just they put a blanket that drug-coated technology should not be used in intermittent claudication and only for CLTI. So in conclusion, well, the evidence with patient-level data has shown that actually there is no increased mortality. However, we are still waiting for the organizations to change their stand, and we need to look more into the risk of amputation. Thank you.